You are too cute.
Do you do high five? Yeah.
On this brand new series of Bondi Vet,
Hey, boys.
be touched by the dedication
We'll have to get him back in oxygen.
of our amazing team
Oh, Billy's in trouble.
as they comfort,
And such a beautiful cat with this owner that loves her so much.
give hope
It's all right, Paul.
and laugh
There you go.
through everyone's favourite Bondi Vet. On this episode,
Hey, honey, what have you been doing?
why greedy honey has ended up in emergency.
I don't know how we're going to get that out.
Buddy's developed a nasty lump that has Danni extremely worried.
I want to get some chest x-rays to make sure this hasn't spread.
Shy Ryder is in the wars,
Ouch! That looks really nasty.
and Cranky Elvis senses intruders,
Out, out, out.
and he's not happy.
Come on, there's your girl.
On the Gold Coast, it's an early start to the day for emergency vets Alex and partner Gerardo.
Let's check her out with the ultrasound.
Yeah, good idea.
Their clinic handles more than 250 emergencies every week. Today, they're starting with an unusual case.
You are not going to guess what happened here. This little one here is the sweet soul is Honey.
Hey, honey, what have you been doing?
Honey's owner saw her with a large object in her mouth.
Ate a spoon.
Ate a spoon.
Not like a metal spoon.
A metal spoon.
Are you sure it's just not gone missing somewhere or?
The owner was getting food ready for the dogs, and then left a bit of food on the spoon, and then next thing you know, bam!
Anxious owner Lyndall is waiting in reception.
I literally dived on top of her to try and pull it out of her mouth, but I watched it go in. It just went in too quickly.
The question now is how to get the spoon out.
The only way to find out is to take an X-ray. If it's a metal spoon, it'll show up on the X-ray.
Okay.
Hey, sweetheart. Yeah, she looks pretty bright. Look at her trotting along, happy as Larry.
What's all the fuss about, hey, honey?
Can't feel anything in it.
No, she's perfectly fine.
Or she'd at least be showing some signs of discomfort. But let's have a look.
We're about to find out.
Ready? Are you ready for X-ray?
Nah, it won't be. Oh my god. Oh my god.
It's the biggest spoon on earth.
Wow, I don't know how we're going to get that out.
It's half the size of her.
Are you okay? Oh.
In Sydney, one of the Shen twins, Audrey, is with Tonkinese cat Misha, who is in a lot of pain with a badly swollen face.
Hi, Priscilla. How are you?
Hey, thanks.
Thanks for getting Misha in the carrier for me.
You're welcome.
Owner Priscilla is hoping Audrey can find out what's wrong with her much-loved 9-year-old.
Her face. Poor thing. I can see it quite swollen there.
Yes. She says yes.
Yeah, she says yes.
Misha's face got really swollen and obviously something was quite wrong and she was not feeling herself. She was like, didn't want to have cuddles and wanted to be left alone. And so we got really worried and we called the vet.
Well, what we'll do is I'll take her into a van, have a good look at her, and then we'll go from there, whether we take her into hospital for more investigation as well.
Okay, sure.
You're worried?
Yeah, I'm sorry.
No, it's okay.
She's my kitty cat,
I
a
know,
special
she's your
girl.
baby girl.
Yeah, I know. Come on, kitty, be okay, right? Hi, Misha. Let's get inside.
Big step up.
We're hoping to find out what's going on with poor Misha. It breaks my heart to see my cat like this. Yeah.
So it's nice and warm.
Yes.
Here we go.
There you go.
Oh, it looks so swollen, so even just you can see how much swelling there is just underneath the eye, just going to the top jaw. Certainly I'm thinking infection at this stage, and just that pus is accumulating under the cheek there. Her back molar at the top is quite red at the root, and there's a bit of pus dripping out behind the tooth. But once that completely heals, we do need to talk about diet and try to prevent her having any further dental disease in the future. We don't want this happening again. No. I am worried. I can see that back tooth is very infected, and what that probably means is her jawbone is also very infected. So I think with the condition that I'm seeing here, time is of the essence. That abscess is very painful and it's actually getting bigger and bigger. So I think best decision is to take her into hospital today. We'll give her a general anaesthetic, have a really good look in there, and just try and get rid of the problem and the infection.
It's always a bit hard with your fur children. They're like family, so I'll work through it because I know she's in exactly the place where she needs to be to get better.
She's gonna be okay.
Yes, my little kid.
On the Gold Coast, Alex and Gerardo can't believe what they're seeing in Honey's X-ray.
I've never seen anything like that before. Have you?
Never a 23 centimetre spoon.
The large spoon is clearly lodged deep in Honey's stomach.
What are the options?
Okay. To me, the only option is to get an endoscope and get her under anaesthetic and scope it out, unless you think there's another option there.
Well, if we go to surgery, remove the spoon from
yep.
the inside, make an incision in the stomach, but let's try the scope first because if we can get that out without having to go to surgery, that would be ideal.
Yeah. The worry is that getting it out, we could cause more damage, but it's got to come out.
The plan that Alex and I have come up with is we're going to put a camera down there, put a snare around it and slowly pull it out, and hopefully it comes out and doesn't cause any trauma.
All right, sweetheart. It's going to give her pain relief directly via her IV, so gets on board as quickly as possible.
Alex and Gerardo have never attempted to remove an object this size from a dog's stomach.
So I guess we give this a go first, and if it doesn't work...
And then it's to surgery. You ready?
Yeah. Nothing yet. Jeez, I hope it hasn't gone down further.
That's it there. You see?
No, where? Up, there it is.
There. Okay, right there.
Okay.
Yeah, you got to keep us in the middle.
Did you want to drive?
If you want me to. I got it.
This is typical. So we can see the very end of the handle of the spoon. What Gerardo's going to do now is try to get a loop of wire around that, and then we're going to try to pull it out. But we've got to remember that the wide part of the spoon is right down in the stomach, and that's the tricky part.
Feeding the loop down now.
I don't know if that loop's going to be big enough.
So we need a new loop because the loop itself is not opening wide enough to go over the spoon handle. So fingers crossed we have one that's big enough.
If this doesn't work, Honey will face surgery.
Oven will plate with gas.
I knew this was going to be hard, but I think it's going to be harder than we think.
Okay, inflating.
Oh, yeah.
Okay, that's better.
Much better.
Now, the trick is...
It's going to be trying to get it over. Oh, yep. Oh, that looks good. Come on.
Try and get that edge.
Come on. Come on, come on. I'm just going to go a little bit further in.
Yes, please.
Yep.
Okay, tighten down, Amelia. You tighten down? Okay.
Okay, tighten down.
Whoa.
We've got Misha.
Come on in. Hi, Misha.
In Sydney, Audrey's about to start Misha's dental surgery with vet nurse Iona assisting.
Right, so we're going to take some bloods and pop her onto fluids, and then after that we'll get her ready for her dental procedure.
Sounds good.
I want to check her kidney function, liver function, make sure that that's all good to take the anaesthetic today. She's an older girl, so we need to watch out for those things. All right, the bloods are up.
The bloods are up.
Great. Okay. Well, it's not unexpected. So these 3 kidney enzymes are all elevated above normal, and not surprising that the globulins are also high because she's got a nasty infection in her mouth. Yeah. There's obviously an urgency to get this procedure done. She can't stay there with an infection growing in her jaw and in her cheek. It's actually burst. You can see some pus coming out from the inside of her mouth, just dribbling down her lip there. But I am a little bit worried. She has got a pre-existing kidney issue, which isn't uncommon in an older cat. So we do need to be careful with the general anaesthetic.
Hello?
Hi Priscilla, it's Audrey from Aussie Mobile Vet. It's all good. She's having a little bit of a cuddle with me and Iona at the moment. The reason why I'm calling is that we've run the bloods and it's not unexpected. 3 of her kidney enzymes are elevated.
Yes.
So moving forward, we still need to go ahead with the procedure, but we'll do everything we can to make sure that her kidneys function well during the anaesthetic.
Thank you so much.
Okay, talk to you
Thank
soon.
you.
All right, bye.
All right, bye.
So now I've got the cannula in, I'm gonna pop her onto the fluids, and that will just keep her well hydrated before we start any of her general anaesthetic. So Misha's a bit of a tricky case because obviously being an older cat and having kidney issues, you're not keen to put her on the anaesthetic and put her through that. But unfortunately, she's got a condition that's life-threatening. If we leave it, we've really got to go in and get that infection out. Otherwise, she could die from that. So we're gonna go really slowly with her anaesthetic. I only wanna give her enough so that she just goes to sleep. We've just gotta be careful with those kidneys.
All right.
No, we found the vein, so I've just given it through the needle. What we're finding is her veins collapse with the catheter, so I'm just gonna give her some time to go to sleep. So what I'm doing there now is just giving her some gas. Like that is. Oh gosh. The abscess has just burst with that pressure.
Good morning, boys. Big day. You all know what you got to do?
At the Australian Reptile Park, Tim and his team are doing some renovating.
Let's get into it.
But it's inside the enclosure of one of the park's deadliest and crankiest residents.
Elvis is the reptile park's 5-metre saltwater crocodile. Crocs are these big monsters, but they're very sensitive. We have carpet on the edges where he comes out. That carpet is deteriorated. When he walks on it now, bringing 500 to 600 kilos out of the water, it creates a little bumblefoot, which can lead to a serious infection. So our mission's pretty simple. We've got a mat that's torn, that's going to hurt his feet, and we've got to replace it as quick as we can. No back to the crocodile. Okay, that's the golden rule. Let's get a bit of food in his belly, and then let's get set up.
The team will be working just metres from the massive croc.
Elvis is hands down one of the park's most iconic animals. About 25 years ago, he was caught from Darwin Harbour for attacking fishing boats, trying to rip their motors off. Fortunately, his life was spared, and he now resides at the reptile park in a territory of his own where there are no fishing boats and no people to hurt him. Dano, just give him a bit of food, mate, to fill that belly up before we start. Might take that interest away from us. Where's he going? Come on.
The water level in the pool will have to be lowered so the team can safely get across to the ripped matting. Elvis is now wary of all the new activity.
Elvis is hands down our most dangerous animal. If Elvis grabs you, that is instantaneous death. He literally has one of the strongest jaw pressures on Earth. It would crush and pop your skull like a watermelon. Oh. Let him have it. Oh. Back up, boys. The feed went well.
Yeah, heart rate went up a little bit.
So now it's our job to get in and get this carpet done. Danny, you stay on croc.
Easy.
We've got to get the pump in, drop the water level. Let's make sure we've got our sticks, and the 3 of us switch right on, and you're on that croc, mate.
Yeah, I'll call out if he moves.
Let's get it done. There's a great level of trust. Dan looks after the croc, we look after the job. The risks are that if you get bitten by this crocodile, if you don't die, you're going to lose a limb. It's a really bad outcome. That's why you've got to have a spotter. That's Dan's job. Watch Elvis.
Tim, he's just at this other bend.
Try and hold him, mate.
Yeah, I'll bring him back. Come on, Elf. Starting to come around again, Zach.
He's on the move.
Yeah, he will move back quick too, so you be ready to go. Come on. Yep, you're right. He's back on me.
You sure?
Yeah, we're good. You're good, you're good.
Right, let's get to work, boys.
He's starting to move, boys. Out, out, out. Boys, he's starting to go.
On the Gold Coast, Alex and Gerardo are working on greedy bulldog Honey, trying to remove a metal spoon from her stomach.
I knew this was going to be hard, but I think it's going to be harder than we think.
They're hoping they'll be able to grab it using a specialised lasso. If this doesn't work, surgery will be the only option.
Try and get that edge. Whoa. Okay.
All right, this is just the first step though, remember? That is a metal on metal and it could easily slip.
Okay.
So we're just gonna have to go really slowly. Yes,
Let's see if we can pull it and
just
Alex.
Go slowly. I'm pulling back and it's not wanting to come. So the problem is that we're getting the wide part of the spoon up to the esophageal sphincter and it won't come through.
So the plan is that we're going to put this down there and we're going to open up, and hopefully that opens up the sphincter so the spoon comes out with it.
The procedure is becoming more complicated than they hoped.
I'm stressed as hell. Forward, Alex, please. They just do not want to go.
Oh, wants to dig a big hole in that esophagus.
So now we're pulling the claw out with the jaws open. We're all pulling, pulling. Pull.
Oh my God.
Okay.
So it's out of the stomach, which is the first step. Now we've got to get it up the esophagus without doing more damage. Ready?
Let's go, guys.
Okay.
Let's go, team. Go. Oh.
Oh gosh. Oh, the abscess has just burst with that pressure. You might need a bigger bag as well later.
In Sydney, Misha's much-needed dental surgery can now get underway, with Audrey keen to keep the 9-year-old cat under anaesthetic for as short a time as possible.
Yep. So she's nice and anaesthetised now. She has the anaesthetic gas going through. So what I'm going to do is change this mask into a tube. Okay. And that will just deliver the gas straight to her lungs. All right. It's a bit hard to manoeuvre with a swollen cheek and a swollen mouth and a burst abscess in the mix, but so far so good. We're just connecting her up to the monitor now. That's going to let us know what her vitals are throughout the procedure. Close. 1, 2.
But suddenly, there's a problem.
So we've got Misha anaesthetised, then she stops breathing. She's actually not taking any breaths on her own, which can sometimes happen, so I'm just breathing for her. All right, okay. She's getting light. Come on, baby girl. Let's breathe on our own. Lucky for us, her heart is stable. We've just got to breathe for her. So Iona's there on the bag breathing for her while I just get on and do what I have to do. So here's the bad tooth. You can see the roots all infected. There's pus coming out the back of it as well. So we're going to have to take that tooth out. I think the reason why this abscess in the cheek is formed is because the root of that tooth has become infected, and that's because she's got bad teeth. So with dental disease, when the plaque builds up and the calculus builds up, it traps bacteria and that feeds into the root of the tooth and the gum. So what I'm doing is slowly pulling the gum off the roots very, very gently. And I'm loosening the tooth from its attachments to the jawbone. I can see that some of those roots have dissolved away, probably because the infection is so bad. Okay, but it doesn't look like a normal tooth because all its roots have like rounded off. So these roots should be much longer than they are. So it's gonna be important moving forward from now, how we keep these teeth as clean as we can. All right, we're gonna suture up this big hole where I took the tooth out of. We've given it a really good flush with saline to get all that pus and infection out. Once we've done this, we're going to clean up all the rest of her teeth and wake her up and send her home. I'm really looking forward to taking Misha home to Priscilla. I know that she's waiting anxiously for her. I'm also really excited to tell her that we managed to get rid of the problem and how we're going to move forward to make sure that this doesn't happen again. Now, are we breathing on our own? Let's have a look. She's breathing now. We're all good.
He's starting to move, boys. Out, out, out. Boys, he's starting to go.
Go, 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 go.
He's not stopping.
At the Australian Reptile Park, Elvis the crocodile has made a desperate lunge at Tim and his team. They're inside the massive croc's enclosure, trying to repair damaged matting at the edge of his pool.
We're good, he's on, mate.
Happy days?
Yeah, jump back in, jump back in.
Okay, back in, boys.
Yeah, you're good, boys. Back in. He's back on me.
Right, let's rip this last bit up.
He's starting to come around though, boys. 40 seconds maybe.
Can you stop him?
Maybe.
Try and hold him, mate.
Yeah.
Righto, boys, we've got to move fast because he's coming.
The waterlogged carpet is heavy and cumbersome, making the job difficult. Elvis senses intruders in his pool.
What are we stuck on?
You've probably got 30 seconds over there, guys.
30 seconds, boys.
Yeah, get him, have to move, boys.
Just tear it if you have to, fellas.
Boys, he's starting to go. Jump out, jump out.
Righto, Dan, we're out.
All right.
We've got the heart going. It's easy to look at Elvis and think, oh, he's calm, he must be trained. He's not. You think about a wild crocodile. Animals don't see them before they attack. They're calm. They creep up. Whack! That's how it happens. And that's what Elvis would do.
With Elvis now on high alert, it's going to be even more dangerous for Tim's team to go back in and try and glue down the carpet.
Everybody's spreading the glue out. There's toes and feet in it, and it's going everywhere. But it's nice when you've got a team all working for a common goal. Righto, Dan, we're coming back in.
Yep, gotcha, he's on me.
I'll just get the corner so you can go down. It's all hands on deck at this stage. The glue's down, you want the carpet on, no air bubbles. More bodies make light work.
Just push it all down. How's it looking, boys?
Good.
Boys, he's starting to go.
Elvis is curious about the team's handiwork.
Look at that. He's coming to have a look at it.
Yeah, all that hard work. What do you think, big boy? Looks like he's smiling.
He's smiling. That's good job for us anyway, boys. Let's hit the hoses.
Yeah, all right. Sounds good.
See what Elle thinks. The pool will take overnight to fill, but as soon as we can get that level up a bit, we can get the heaters on, get his water warm, job done. He's had a look. He's back in the deep spot. The hoses are on. We're all safe. We've got one happy croc. Let's get out of here.
Let's get out of here.
In Melbourne, new mum Danni is saying goodbye to her family before she heads to work at a busy vet clinic. Her first patient is a 12-year-old Beaglier called Buddy.
Hello guys, how you going, Deborah and Erin? You well?
Good, thank you.
It's good. What brings Buddy in today?
A couple of days ago we found I was pashing him and I found a lump.
Oh, okay.
Danni examines the right shoulder of the much-loved family pet.
Okay, I can feel that there. So do you think this came up quite suddenly?
Yes, it did.
Okay. Has it changed much since you've noticed it?
No.
Like it's gotten any bigger at the moment? No? Okay.
Stayed the same.
Alrighty. Well, what we might do, I'll bring Buddy into the clinic, we'll have a look at that lump, get a sample, and I'll give you a call and we'll make a plan from there. How does that sound?
Good, thank you.
Sound good?
Yeah.
Okay, Buddy boy, you want to come with me, mate? You good boy? You sweetie pie. All right, you say goodbye to Mum. Come on, mate. Buddy, come on, Papa. Hey. Oh, thank you. Good on you, mate. Yeah.
He's an unusual looking cavalier, isn't he?
Yeah, he's actually got beagle in him. So he's Cavalier cross beagle. Hey? So he's quite a cute little mate, aren't you? Hey?
Beautiful little breed.
All right. Do you want to have a little listen to your heart? So we have got Cavalier in there. Yeah, make sure we haven't got any murmur. Good boy. All right, mate. So we'll just look at this lump. So there's the lump there.
Okay.
Yeah, so the lump is feeling quite firm there. It's in that subcutaneous tissue. So we'll have to get a little sample to see what it could be.
Yeah, definitely. Make sure it's nothing nasty.
Oh, we're brave, so all right, just grab that little lump there.
Good boy. Very brave.
Poor mate.
Well done. Good boy.
I'm just taking a needle sample from this lump on Buddy's shoulder. I'm going to have a look under the microscope because that will give me the best indication of what this lump is. And unfortunately, I am seeing some cells there that I really don't want to see. So I'm concerned that this could be quite a nasty tumour. So I do think we really need to get onto this quickly. I want to get some chest x-rays to make sure this hasn't spread. And then if we're all clear on that front, I want to head straight to surgery for Buddy today. You're very brave.
Good boy.
On the Gold Coast, Alex and Gerardo are almost an hour into the delicate procedure to remove a 23 centimetre spoon from Bulldog Honey's stomach.
Oh, it's coming out.
Yeah, that's pharynx.
They've been extremely careful not to cause any internal damage to the young patient.
Here we go. Oh, look. Oh my. Wow. Oh my goodness. It's a spoon.
That was.
Cannot believe it. Good job, guys.
Look at that. That's how big that spoon was.
She's going to be so sore tomorrow. I cannot even imagine. I think probably rest in hospital tonight and then get you home in the morning.
The big test now is to see if Honey's appetite has been affected.
All right, I've got some chicken here for her. It's a really good sign if she eats a bit of this. Ready? You want to see how you can swallow? Because I would say, if I was you, I would have a very sore throat. All right, let's just start with a little bit. Oh, thank you. Oh, no problems there at all. You are one lucky dog. Good girl. So we're going to send her home on some medication just because she's got some ulceration from the trauma from the spoon. And we want to make sure that that all heals up. She's off. In here, in here. This way. Who's in there? Who's in there? Oh. She just ate a little bit of chicken for me then, so just want to make sure she was all good with that. And I also thought I'd better give you the spoon. I don't know if you still wanted it, but I thought you should really hold on to that, so okay. Good girl, hey? You've got to stay out of trouble.
Thank you.
See you guys. I think she's going to be one very lucky dog.
Oh, she's a lovely owner. She absolutely loves the cat.
In Brisbane, the other Shen twin sister Alison has had an SOS from a family with a very pampered cat.
How are you? Good.
Mum Lawton says Ryder is the boss of the household.
Ryder is about 7 years old. The boys absolutely adore him. He sleeps in our beds. He follows us around like a dog. He's just gorgeous.
All right, shall we pop you to the van and have a look at this wound?
The family wants Alison to check out a nasty wound on Ryder's leg.
Come on, Ryder. Hey, get you in. All right, let's get you out.
So we get Ryder in the van and we take him out of the carrier. And at first impression, he looks pretty good. I mean, his coat looks really good from the outside, but he's a little bit nervous at this point because he's not used to strangers.
Oh, your heart's going really fast there. You are scared.
We took him from RSPCA as a rescue cat. So as soon as someone else is around, he gets very uncomfortable and very scared.
We'll try and make this quick and painless, I promise.
It's like he's got trust issues.
Hey, baby. Okay, so where is this lesion?
He's on the inside of his back leg.
Okay, I'll get you to show me.
Come on. Come on.
Oh boy, well, there you go. You're being really good. Oh, Ryder, ouch! That looks really nasty.
Poor thing.
In Melbourne,
Hello, Deborah.
Danni is getting the owners okay for surgery on Buddy the Beaglier.
There are some lumps that are looking quite suspicious to me that could be some nasty tumour cells. So I think it'd be really important that we get this lump off Buddy as soon as we can.
Okay.
It's really important to get a chest x-ray just to make sure that whatever is happening there hasn't spread to the lungs. Now we'll just get your fluids connected.
Danni is concerned about Buddy's size.
With any anaesthetic, there's always a risk, but when we are particularly overweight, like Buddy here, there is an increased risk of anaesthetics. We just have to be really careful about our monitoring, making sure he's breathing well and that he's coping with the anaesthetic today.
X-ray.
All right, let's see what these x-rays look like. Okay. There's no evidence of any spread of this tumour to the lungs, but we aren't out of the woods yet. Until I get a biopsy of this lump, I'm not going to know how serious this is. So for Buddy, it means we've got to get to surgery ASAP. He's a good boy.
All right, chickadee, we're on the way home. Mummy's gonna be very happy to see you.
In Sydney, Tonkinese cat Misha has recovered from her dental surgery, and Audrey is returning her to owner Priscilla.
Look, there's Mummy. Hi, Mama, we're home.
Hi, Misha.
She's been such a good girl for us.
Oh,
Hey, baby girl.
She looks so good, much better.
Yeah, I'm gonna take her out so we can have a closer look.
Awesome. Welcome home, Misha.
Wanna come out to Mama? Come here.
I'm feeling so relieved right now that my Misha is home. Thankfully, she's so much better now, and I think within a few days she'll be back to her own little sweet self.
So everything went really well in hospital today. I'm really happy that we took that tooth out because there was so much pus and infection behind it, and that's why you had that bubble on the cheek bursting through. Also on the other side, I think that was also about to happen because there was quite a lot of pus in there as well. So we've given it a really good clean, a really good polish, and moving forward, I think the key is going to be keeping her teeth clean so she never gets another abscess again. Such a good girl for us in hospital today, weren't you, chicken?
She looks so much better.
Yeah, her face has gone back to normal, hasn't it?
Yes, she's got cheekbones back now.
You got your cheekbones back.
Yay.
All right, chickie. I'll see you in a couple of days. All right, bye, Priscilla.
Bye. Good girl.
Hi, Kate. How you doing? Hey, Margaret. How are you? Hi, sweetie. How you been? Yeah, good. Are you coming to visit? You've always got something exciting.
Yes. Have a look today.
I've been able to get a little sneak peek at reception. I can see a little bit of fur. I'm just hoping that there's not too many sharp claws and there's a whole lot of cute and cuddly.
Very sweet little fellow.
Come on in.
At Kate's Bondi Vet Hospital, carer Margaret has arrived with a mystery visitor.
Look what is in this bag. Hello there.
This is Wilbur, Kate.
Hi, Wilbur.
Say hi to Kate. So Wilbur's a 10-month-old baby wombat. The mother was a roadkill, unfortunately.
Oh, did your mum get hit by a car on the road?
Yes.
So this is his 4-kilo check?
Yes, please, yes. I just wanted to make sure a few things were right with him.
The little orphan is being hand-raised, but hopefully one day can be returned to the wild.
Are you a bit nervous about coming to the vets?
Wilbur, he's quite a strong-willed little animal.
Goes out, I know Wilbur. I know. He's like, I don't know about the vets. I don't know about the vets. I can hear your tummy grumbling. So what we might do, Margaret, is I'm going to get you to hang on to him.
Hold his teeth.
I know, sweetheart.
Shh. Otherwise you won't get him.
Hey, Wilbs, can we just have a look at your little choppers?
Good boy,
They're
Wilbur.
beautiful. These are looking really good. You've obviously been giving him quite a lot of hard things to chew on. Good. Can I just have a look at these back feet?
Sure can.
Mm-hmm.
You're doing so well.
Yeah, have a little listen.
Oh, if he's going to let you.
He's a little wrigglewort, isn't he?
He's a wrigglepot.
You're a little wrigglewort. No murmur. Heart rate's good.
He has been a little bit itchy, and I wasn't sure whether it was due to the digging or the fact that he's only young and he's first just coming in.
Yep.
But I would like to just have a look to see there's no mange issues.
You know, his fur is a lot shorter around this back end than up around here, so you can just feel how it's quite lush around up here, and it looks like he actually does do a little bit of rubbing down this back end. These guys do get psychoptic mange.
They do, yep.
Australian wombats are really prone to getting what they call psychoptic mange. It's a little microscopic parasite that burrow into the skin and make them really itchy. So Margaret, I am going to actually give you some things to treat psychoptes.
Okay, great.
Okay,
Thank
so
you.
it is a really common problem in the wild, and you know that even sometimes when we treat it, it can come back at a later stage anyway.
Yep. It's just good having that reassurance. Really appreciate it.
See you, Wilbur.
You're okay, little mate.
In Melbourne, Beaglier Buddy is being prepared for surgery after Danni discovered cancerous cells in a lump on his shoulder.
Whenever we take out a lump, we do need to make sure that we're getting enough of a distance from the lump that we gather all the cells that are involved in it. If we do leave any cell behind, then potentially that same mass can regrow. So that's why we're getting a nice big margin when it does look like it could be quite aggressive. Don't want to take any chances. All right. I'm really happy with how surgery's gone. We've managed to get the entire lump out. Now we just have to send that off to the pathologists to get a biopsy done, and fingers crossed it's a good result for Buddy. All right, you just rest up now, mate. Okay? You rest up, sweetie pie.
So where is this lesion?
It's on the inside of his back leg.
Oh yes, there it is.
In Brisbane, Alison is checking out a nasty wound on rescue cat Ryder's back leg.
Oh, you can definitely see he's been licking. Yeah, so what he's actually done, I'm presuming because you've seen him lick, he's actually sort of torn the skin apart there. And because in his mouth there's a lot of bacteria naturally, he's probably given himself an infection. So open wounds and open lesions like that we do worry about a bit more. It's really done some damage to this side of the leg.
It's really nasty. There's been a lot of licking, there's definitely been a lot of chewing, and he's actually bitten through his skin, so there's actually open wounds there. And that's a problem because it can get quite infected, and that infection can spread.
Alison is starting to suspect the reason why Ryder has been licking and chewing his leg.
So I know that you have seen a couple of fleas on him in the last couple of days. So that definitely sounds alarm bells to me, because he could actually be quite sensitive to the fleas, and that's what's triggered off the licking. I mean, at this time of year, we certainly do have a lot more fleas around, as well as probably in his environment.
So I'm going to give Ryder a good check over. I'm going to use my little flea comb and just see if I can see any live fleas or flea dirt, which is actually flea poo, just to give us an indication if that's what we're dealing with today.
Oh yeah, there could be some just up here, you see that skull?
We can definitely see evidence that there has been fleas. So it's actually dried blood, because after the flea bites Ryder and it defecates, it actually has the blood that comes out the other end, and that's what we see there.
That's not good for your mum and dad?
I'm really concerned because Ryder does sleep with you guys in bed, and with all those flea dirt and flea eggs around, I'm really worried that they might be hatching and then causing you some issues if the flea does bite you at night. So we definitely need to make sure we're cleaning the environment. So washing the sheets in just some very hot water to make sure that we kill all the fleas, the flea eggs and the flea larvae, just so it doesn't pose any health risk to you and your family. So at this point, it's looking more and more like this is actually a flea allergy dermatitis, so an actual skin infection due to the fact that he's been quite allergic to the flea saliva. If Ryder actually ingests those fleas from all that licking and chewing, he may actually get a secondary infection with tapeworm, which is an intestinal worm which can cause a lot of problems. All right, so we're going to treat the infection first, because I think that's his main cause of discomfort, all that infection.
Hey, buddy. So I'm going to give him some oral antibiotics, so it does mean some tablets. And the other thing I'm giving you today is just a topical cream. It's got a bit of antibiotic, but also something in there to stop that itching. So it's just a little vial of liquid that you pop at the back of the neck every single month. And it's really good because the fleas don't actually have to bite to get the product. So that means he won't have any flea saliva injected into him, which we know he's very allergic to.
Boy.
Shy Ryder is being very patient as he gets his first dose of flea treatment.
No more fleas.
It needs to be applied every month. It's a quick, simple, easy way of preventing against fleas, and the difference it will make to Ryder is immense. So we do need to address one other area, which is the environment. So wherever Ryder's been sleeping or spending most of his time, there's quite likely to be a burden of flea eggs or flea larvae. So a good idea will be just to clean the bedding wherever he sleeps and just give that area a very good vacuum so we've got the environment under control.
I'm really happy that Ryder can go back to being his happy, comfortable self again, and hopefully it does the trick.
In Melbourne,
Want some food, buddy?
Danni's patient Buddy is recovering from lump removal surgery, and he seems to have worked up quite an appetite.
Yum, yum. Yes.
I think Buddy's a little bit excited to get some food and he's recovered really well, so it's time for Buddy to go home. Hello! Here he is.
Owner Deborah and her daughter are excited to see their special boy.
I'm really happy with how everything went today. We've sent that lump off to the lab, so we'll give you a call once the results come through, but fingers crossed everything's going to be okay. Here's some pain relief in this folder for you to get started, all right? And we'll speak to you soon. Okay. All right, you take it easy, little buddy boy. You just rest up, mate. Hey? Oh, do you want me to help you with him? Oh, dear. Oh, mate. Oh, you tubby boy. All right, you okay there? We'll speak to you soon, okay? I'll get that for you. See you later.
2 weeks later, 12-year-old Beaglier Buddy has recovered well from his lump removal. And great news for his owners, his biopsy results have come back all clear. Greedy Honey is also feeling a lot better after having that large spoon removed from her stomach.
Spoons are definitely off the menu for Honey.
Good girl, yeah.
Cheeky Wilbur has no more skin issues and is continuing to thrive. And 9-year-old Tonkinese Misha is now eating and enjoying life pain-free.